In the medical education system, students tend to diagnose themselves with the diseases they learn about in class. These are their stories.
Dr. Wells, I'm a nephrologist here in Fort Wayne. You know that I'm a real doctor because I have a stethoscope, which I never use. I just got off 52-hour call, so we're just going to blow through these 700 slides on glomerulonephritis. So I've been practicing medicine for over 30 years, and it's really important that I tell you everything that I know in this 1 hour that I'm going to be lecturing, even though you won't need to know any of it, and most of you, all of you will never be nephrologists. I'll tell you a lot of things that are way over your heads. You guys are residents, right? Or what are you? What classes have you had? I'm not going to be clear or highlight what you actually need to know for the exam. There are 5 slides out of the 700 that you will be tested on. You are going to have to spend 3 times the amount of length that you actually should studying for this subject. But before we do that, I want to tell you a little bit about myself.
1 hour later.
And that's how I got to be a nephrologist. Our first topic is glomerulonephritis. The main cause is unknown, but it is thought to be due to problems with the immune system. An abscess that is disrupted travels to your kidneys through the blood, or possibly a history of cancer. Oh, good question. Okay.
Yeah, so it says here that pain on urination is a symptom. So is that like a diagnostic?
So that's actually a really good question. Let's talk about that.
You probably just have a UTI or gonorrhea.
Okay, so we have 5 minutes left. I know you're all supposed to have a break, but we've got 85 more slides, so I'm just gonna keep talking.
Guys, I never have acne, and I have such a horrible breakout right now. I mean, would you look at this? I have no idea what's happening.
Hello everyone, I'm Dr. Phillips, and I am a dermatologist.
Oh, I guess our 5-minute break is over.
I know that most of you probably think that what we dermatologists do doesn't make much of a difference, that we just treat severe cases of acne and maybe freeze off a wart here or there. But let me tell you that skin can indicate a larger problem lying underneath. Always remember this one case where a woman about your age came in with severe acne. And you'd think I'd just prescribe her a cream and send her on her way, right? Wrong! Take a complete history and physical of every patient that comes into your office. And it turned out that this woman was pregnant. She had other symptoms as well: nausea, fatigue, cramping, and some other symptoms of pregnancy include frequent urination, change in color of the vaginal area, missed periods, and tender breasts.
Wow, this is hilarious. I have a lot of these symptoms, but there's no way I'm pregnant, right?
Myoclonus. So this type of seizure can really be picked up in clinical with subtle movements. It's a really quick, jerky motion. And don't forget about cancer. Cancer can be a part of the diagnosis for any seizure. You know what? Scratch that. Cancer should always be on your differential. Cancer is with everything. Did you just throw your pen at me?
And I think I just do that sometimes because I don't know how
So now we're going to move on to Klinefelter syndrome. Klinefelter syndrome is a genetical disease that affects the X chromosome. An affected male will have an extra X chromosome. So a Klinefelter male will have both neuro and physical abnormalities, such as mental retardation, reduced facial hair, gynecomastia, small testes. A child presenting with this disease would look something like this.
That looks just like you.
Well, that wraps up today's lecture. Are there any questions?
I can't believe everybody thought they had all those diseases.
I know, right? You want to grab some lunch?
I can't. I have to go get an MRI. I might have a brain tumor.
No students portrayed suffer from the diseases described.